my name is Casey. I am a college student studying nursing, and I am also a mother. And once I started researching different schools in the area, knowing that my child was going to be going to kindergarten in a couple of years, I realized that most schools teach abstinence only, if anything at all. I realized that there is a need to show legislators and educators that there is a need in schools for comprehensive sex education to go beyond abstinence only so that we can help kids prevent teen pregnancies and STDs. Teaching about basic anatomy and physiology, as well as effective methods of contraceptives, will help to give our young people the tools that they need to make educated decisions about having sex, when they're going to have sex, if they're going to have sex, and if they're going to use contraceptives. If you don't give them those tools, it becomes a whole lot more likely that they're just not going to use any type of method of contraceptives. In order for kids to make the right decisions, they need to be getting medically accurate information. Currently in Texas, it's not required to give medically accurate information. I'm not saying that we shouldn't teach abstinence. Abstinence is 100% effective in preventing teen pregnancies and STDs, but only teaching abstinence is like giving somebody a hammer instead of an entire toolbox. In addition, teaching young people comprehensive sex education is not giving them permission to have sex. In fact, there is no correlation between sex education and having sex. In reality, the amount of teens reporting to have engaged in vaginal intercourse is about the same as those who were taught abstinence only. Those who have all the information are much more likely to prevent a pregnancy, and if properly explain the ramification of STDs and teen pregnancy, they'll be more likely to wait until they're of a more appropriate age to have sex. The key takeaway here is that accurate and comprehensive education empowers young people to make educated decisions about sex. Those who have all of the information are much more likely to prevent a pregnancy, and if properly explain the ramifications of STDs and teen pregnancy, they'll be more likely to wait until they're of a more appropriate age to have sex. Not only is Texas rated number 3 in teen birth, Texas also has the highest instance of repeat teen pregnancy. Not only do we have teenagers who aren't getting proper education, now they're having multiple teen pregnancies because they're not given access to the contraceptives that they need to prevent that from happening. Only 2% of teen mothers will go on to get a college education before 30. The socioeconomic impact of teen pregnancy can be prevented by simply expanding curriculum beyond abstinence only. We cannot pretend we live in a perfect world where everyone waits to have sex until they're married. This has proven to be a school of thought that has resulted in young people ages 15 to 24 having 50% of the nation's STDs. That's 15, 16, and 17-year-olds contracting gonorrhea and herpes because we, as the adults who have the power to make this curriculum, are not giving them accurate information, or information at all in some situations. Through my YouTube channel, Yes You Are Normal, I hope to give young people the information that they're not receiving at home or in school, and I'm going to try and keep it as accurate as I possibly can. I hope that educators and legislators will see that there is demand for this information and will go on to implement comprehensive sex education programs in their schools. I encourage you to consider implementing these programs so that kids don't have to go to their peers or to the internet to get this kind of information. We have a responsibility to our kids and to our young people. We can't withhold information because we think they're going to use it to do what they're already doing. Please follow the progress and reception of my YouTube channel and consider moving beyond abstinence-only education and into comprehensive sex education so that we can keep our kids safe and informed.